Let's move on now to talking about what the goals for treating Alzheimer's disease are and what the treatments are that we do use. Our primary focus is on trying to slow or hold the progression of memory and cognitive symptoms, but we can't reverse and prevent them from happening. We're literally just slowing the course with medications. We want to be able to try and hold function for as long as we can or improve a person's ability to do something. We want to improve behaviors. We want to be able to improve mood. And we also want to make sure that we're keeping an eye towards maintaining weight and appetite, because as the disease progresses, we can often see a change in food preferences and people move towards sweeter foods and not want to eat certain foods. And so if we're not recognizing that transition or not recognizing the need to provide more cues for eating, we can begin to see weight loss. So it's one of the reasons that you see weight is always taken when your loved one is going to a doctor's visit. We want to monitor and improve sleep. We can often see people have trouble falling asleep, staying asleep, or getting up unnecessarily early. We can see them sleeping more during the daytime and sometimes excessively during the daytime, and then not sleeping at night, so that we can see this complete reversal of day and night. And that's when we want to be able to stabilize sleep patterns. We especially want to feel that you as family, as care providers, whether in the community or as family care providers, are receiving the necessary education and information you need to understand the changes that your loved one is experiencing, to understand what the best interventions are for you to use, and to be aware of those valuable community resources. We want particularly to help you focus on the content, on the quality of life for your loved one. Our policy is to have people feel engaged rather than isolated. And this has been a concern over the years, that people, when they were diagnosed with Alzheimer's disease, were given the diagnosis and essentially sent home with their families, and families had to fend for themselves in terms of what can they do for their loved one, and over time experienced a real sense of isolation and withdrawal from other family members, from friends, and from community events. And what we encourage wholeheartedly very early on is to find those activities that still have meaning, that can be engaged in, that you can do together, or that your loved one can do in conjunction with a neighbor or other family member or a friendly visitor from a home care agency. When we focus on finding meaningful activity and helping them accomplish that, that's how we affect quality of life. We want to make sure that in assuring their safety and psychological comfort, that we're reducing risks for things like secondary disability. This would also include making sure that we are managing medical issues. So making sure that their blood pressure is in a good range so that we don't invite the risk of stroke or heart attack. That if they're having gradually more unsteadiness or difficulty with their walking, that we're getting physical therapy in a timely fashion, that we're using walkers as appropriately to make them safer with walking, because we want to avoid the falls that might produce fractures, and fractures needing surgery, and surgery then needing hospitalization and stays in rehab facilities. So reducing the risk for secondary disability is a very important part of treatment of Alzheimer's disease.